everyone, Justin White here, CEO and founder of Senior Health Services. Welcome to another installment of Medicare Monday. And today we're going to talk about not so much Medicare, but a benefit that is listed in the Medicare stuff that causes a lot of confusion. It looks like it's covered, but it's not covered in the way that most people think it does, and certainly not the way they want it to. And I'm talking about home health care. I get calls all the time where people are calling and they say mama fell down or something happened and they're not able to take care of themselves in the house and they need help with things in the house, or they need to go to a facility or something, and we need to check on their Medicare because I see it's in there and it looks like it's covered, so we need to activate that, and how do we do it? I'm like, oh, I hate those calls because I have to tell them that home health care and Medicare does not do that sort of thing. It never covers what people want. It's not going to cover anything custodial. They change a bandage and they leave. I mean, what they do is kind of happens fast and then they go. They don't clean house or anything like that. So what in the world do you do? You know, a lot of people call up and they're like, well, I can't afford or I can't qualify health-wise for long-term care because it's getting expensive and harder to qualify for. So what in the world do we do? And folks, I think this is probably one of the, if not the worst, crisis that's coming up for Americans in the coming years, and that is the need for help that is going to be of the custodial type that happens either in the home, preferably in the home for most people, or in a facility. How do we stay in the home for as long as possible and deal with these things as we get older or as accidents and things happen? And folks, I'm going to tell you, the reason I'm coming on here is because there are some products that have come out that offer surprisingly robust coverage for stuff like that, particularly home coverage. So the only thing worse than having to deal with this just in real life, even under the best of circumstances, you may have the greatest policies on the planet, and then you start getting into where help is needed in the home or they need to go somewhere, and that is excruciating even when there's stuff there. When they need help and there's nothing there, it's a nightmare. So these products provide something where there's nothing now. And there's underwriting and there's health questions and things that you have to pass, but it's nowhere near as difficult to pass, and it's nowhere near as expensive as the traditional sources of long-term care that we all think about and that everybody prices and goes, oh my gosh, wow, it's kind of expensive for what I was expecting. Because truth be told, long-term care needs to be purchased usually, you know, say starting around 45 to say 55, maybe 60, but even at that, it's going to be getting higher and more expensive. So if you are needing and have questions about that or needing quotes about that, and would like to understand more about these products, many of them brand new that have come out, give us a call at 281-894-7540. That's 281-894-7540. Or you can go to the website at seniorhealthservices.com if you want to check us out before calling. It's a simple phone call. We can let you know kind of what they are and give you an idea about it so you can determine whether that may be something that would help you. Okay? My name is Justin White. I'm the CEO and founder of Senior Health Services. Thank you so much for watching, and we'll see you next week on Medicare Monday.